Hi, Don Goldberg here with TechView, and our guest today is Joel Selanikio, who is the co-founder of DataDyne, but he's not here to talk less about the company, but to talk about some other things that he's involved in. But Joel, thank you for being here. But first, tell us about DataDyne and sort of what you guys are up to these days.
Sure, thanks. DataDyne is a small organization, what's generally called a social enterprise. So we are attempting to use the tools of technology we have today, like the World Wide Web and the mobile phone, which are not only tools here in the United States, but also tools in some of the poorest countries on Earth.
Right.
And we're using them to deliver better technology for public health, better technology for international development.
So what we're really talking about today in this little interview is going to be the intersection of public health and technology and policy as well. But let's talk about your background and how you happened to get into this, because you've got a very eclectic group of skills back there. So give us a real quick sense of sort of what you've done and why you've tied them all together.
Sure, of the series of random events that led us here. Well, I started out, when I graduated college, I had a degree in sociology with a minor in computer science. And I went to work on Wall Street for what was then Chase Manhattan Bank.
Mm-hmm.
And it was a great job. I enjoyed it a lot. Got a lot of friends from back in that period. But for various reasons, I decided I wanted to be a doctor. So I left Chase Manhattan after a couple of years and went back to school, became a doctor.
Which in and of itself is probably very unusual to leave a big Wall Street job to go back and school.
My boss at the bank was surprised. Was surprised when I told him I was leaving to go to medical school. And then I did a pediatric residency, became a pediatrician, and then I started working at the CDC, the Centers for Disease Control, in Atlanta. And I guess the funny thing is that I thought when I left the bank that I was leaving technology behind,
mm-hmm.
that my technology expertise was actually not going to really figure in my life after that point. And what I found after working in public health and working overseas is that it is critically important to have an understanding of technology to be able to use, again, all these amazing technologies that have come up lately, like the web and the widespread mm-hmm. mobile phone. It's just critically important to understand them to be able to build the tools that people need to use them.
Well, talk about some of the things you're doing in third world countries, and I know you've been to Africa a few times, and how you've married technology together with the public health initiatives you're working on.
Sure. Well, one thing that I have been thinking about for decades is data collection. People don't often understand that when you hear a statistic, for example, what percentage of people in such and such a country are HIV positive, that all that information comes from doing surveys. So you have troops of people, 10, 20, 50, 200 people going to 20,000 households in Namibia and knocking on doors and asking people questions, exactly actually like the US Census does. And it's all done on paper. And even 15 years ago, I thought, which was about the time that the Palm Pilot came out,
right.
I thought, why are we doing this on paper? Why don't we use computers, since now there are cheap pocket computers? That question is probably even more pressing now, that you don't have to run out and buy a Palm Pilot, and of course those are extinct basically.
Right.
But everyone is carrying around a mobile phone,
mm-hmm.
which essentially is a PDA plus a phone. So before we had to worry about, well, how are we going to buy all the hardware? Now every single public health worker, almost without exception in sub-Saharan Africa, is walking around with a mobile phone.
Mm-hmm.
Every school teacher in Latin America has a mobile phone. Every business person in Southeast Asia has a mobile phone. And the sad thing is that what we're mostly doing with these mobile phones is making calls and sending text messages.
Right.
What we're really not doing is using them as the powerful computers that they are. And so one of the things that we do at DataDyne is we look at a health problem like the need to collect all this data currently on paper, and we design simple systems that let people collect it on a mobile phone instead.
Mm-hmm. So you've got this technology that's becoming ubiquitous even in third world countries, but it's not really being leveraged. So if you can develop an app or some sort of way to have the people in the field use it.
Sure. I mean, we're going through a period of evolution of this technology that's actually very similar to what happened with PCs. First you got a PC back, I don't know, in the 80s. It wasn't connected to anything. You had all the software was locally installed on the computer. You could do word processing and whatnot. Then, of course, it was amazing when they got connected to each other, so that you could send emails back and forth, and that's about all you did. And then we got the World Wide Web, so you could start seeing all this information. Then they had Web 2.0, where you could start actually putting information online.
Right.
All the same thing is happening right now with the mobile phone. First, the first step is people they had the PDAs, which were not connected, like
mm-hmm.
old PCs.
Right.
Then mobile phones, which go through that connection period. But we're still sort of stuck in that stage where people are just kind of one-on-one sending messages back and forth.
Right.
And there's probably not a mobile phone in this building. There's probably not a mobile phone in the Ministry of Health in Kenya that isn't 1,000 times more powerful than the mobile phones that they used at NASA back in the 60s to send people to the moon.
Right.
So it's not like the processing power is not there. There's a tremendous amount of stuff that we could be doing and that we at DataDyne are starting to do.
And so what do you need to get to that next step? What are the challenges and what are the opportunities?
Well, for us the challenge is always business model and funding. Where do you get the funding to do this? And I think actually that's been one of the real revelations to me, because I'm a public health doctor. So when we first started developing, for example, EpiSurveyor, which is our super simple web tool that lets people design forms and put them on phones to collect data. When we first started doing that, I was just, I just knew it was a good idea, wanted to get it out, wasn't thinking of how to pay for it, and we applied and got several grants, for which we were really grateful and are really grateful. But what I've realized over time is that everybody needs to collect data.
Right.
And for example, again, the US Census is done on paper,
Right.
and that's in the United States. What we're starting to realize is that we have easily the simplest, least expensive approach to collecting data on a mobile phone, whether that is US Census data or whether it's information about HIV in Africa. And so we're realizing that we have lots of potential corporate customers who need to go out and collect data, and this is where the business model comes in, because what we're now attempting to do is to get revenue from selling those services to those corporates and large organizations, and not just sort of use that to buy a bigger house, but use that to actually provide the same level of service to everyone in the world for free. And we couldn't have done that if everyone in the world didn't have a mobile phone. We couldn't have done it if we didn't have the World Wide Web, which allows us to do things like Gmail. Google doesn't implement Gmail country by country.
Right.
They just put it on the website and boom, it's there. And it doesn't cost them more to have Gmail in every country of the world than it does to have it in one country, or marginally more.
Right.
And we're using exactly the same kind of leveraging of that ability to scale and say, look, we actually need just a reasonable amount of money, which we can get by selling these services, and then giving it away to Ministry of Health of Kenya, giving it away to small NGOs, giving it away to researchers. So we think it's a really powerful application of a kind of a Silicon Valley technology and a Silicon Valley business model, and we are the first ones to be applying it to public health.
Well, then hence you have the intersection: technology, policy, public health,
Sure.
the business world. It's a great example of how we can really apply these technologies for the better good in the public health sector as well.
Yeah, it is. We think it's, of course, a great application. The thing that's interesting to me is that it's surprising to me even that we're the first who seem to have thought of it. All of us use webmail, all of us use Google Maps, all of us use Facebook and all these other tools online, so we're very familiar, intimately familiar with the idea of putting software on the web so everyone can get to it everywhere. In public health, there are no other web applications besides EpiSurveyor. In international development, there are no web applications besides EpiSurveyor. And it may just be sort of, for me, it may be because I'm thinking about this all the time, and we're the first. It's just, you're thinking, well, surely this is just going to be a dam that's going to break, and then everyone's going to realize it. And what I've come to realize is we may be the people who are actually making the first chip at that dam to take down that wall and really bring some powerful software to bear against some of the biggest public health problems that we have.
Well, it's a great place to be, and it's got to be very exciting for you.
It is exciting. That's a good word. It's exciting. It's exciting. It's scary. It's busy.
Yeah.
It's terrific.
Well, Joel, thank you for being here, and we're going to have you back on when you've got time and you're back in Washington, because we want to follow how this is going and really talk about public health as a real technology opportunity, for policymakers. So thank you very much for being here.
Oh, it's a pleasure.
I'm Don Goldberg for TechView.